So here I'm going to talk about the basic of pharmacology. What is pharmacology? They said it is the exploration of substance that are used to heal and comfort the sick and in other way to help us to live longer and healthier lives. Pharmacology, it is the branch of medicine that concerned with the uses or indication because of sickness, or it deals with the effect of medication, mode of action of drugs. The three phases of drug action. One is pharmaceutical phase, now pharmacokinetics, and pharmacodynamics. So pharmacodynamics, it is the study of biochemical and physiological effect of drugs and their mechanism of action at organ system or subcellular level. So pharmacokinetics, this it is the body action of drugs, body action on the drugs. But pharmacodynamics is the drug action on the body. And here the pharmaceutical phase deals with disintegration of dosage form or dissolution of the drugs in the body. So dose formulated drugs, when we intake, which is called administration, then come pharmaceutical phase, including this disintegration and dissolution. Then your drug is ready for action, drug available for absorption in GIT. Absorption, distribution in the body through the blood, and metabolism inside the liver and excretion by the kidney. All of them discussed in pharmacokinetics phase. And pharmacodynamics, particularly drug receptor interaction. So difference between pharmacokinetics and pharmacodynamics. So pharmacokinetics, how a drug moves on and what the body does to a drugs. But pharmacodynamics, how a drug behaves and what the drug does to the body. Next, here, three phases of drugs action. Pharmaceutical phase, solid form, maybe tablet, maybe capsule. It is dissolved and then liquid form. And next here, pharmacokinetics phase, drug go for absorption, go through fast pass metabolism or effect, go for distribution through the circulation. They bind with the protein in circulation for transport to the target organ in the liver, and metabolism start. Onset and peak the duration. Finally, our kidney helps to expel out excretion, right? And also drug concentration go half, it is called half-life. Pharmacodynamics dynamics phase, particularly it is interaction with receptor, maybe agonist, means stimulation of the function, maybe antagonist, opposite the function, inhibit. Pharmacokinetics to work together, maybe disintegration or dissolution. Integration means breakdown of tablet into small particles, and dissolution of the smaller particles into gastrointestinal fluid before absorption. So in this picture, big tablet broken down to small molecules, and this is disintegration. Finally, dissolution for absorption. Pharmaceutical few information every student must know. Approximately 80% of drugs are taken by the mouth, and pharmaceutics is the first phase of drug action. In gastrointestinal system, drugs need to be in solution to be absorbed. The solid form, like tablet or capsules, must be disintegrated into a small particles to dissolve into liquid. Because solid must be broken down, make it solute, then go for absorption. Liquid drugs are already in solution. Filter or excipient are used for size, shape, and dissolution drugs. Some additives we add to increase the absorption. Like penicillin is a broad spectrum antibiotics, but if you add penicillin with sodium or penicillin with potassium, absorption will go up. Pharmacokinetics, as I told you, how a drugs move or what the body does to a drugs. It is the process of drugs movement to achieve the drug action. How we can achieve the drug action? By absorption, distribution, metabolism, and excretion. 4 phases of drug movement. Absorption via gastrointestinal mucosa, distribution through the circulatory system, means our body fluid, blood, and metabolism, chemical reaction and produce small molecules or ATP via metabolism process occur inside the liver. And finally, waste product expel out from the body through the kidney. And also diffusion occur, either passive diffusion or active transport. And here showing a flow chart. When we take the medication, injection of medication or pill, go for absorption, medication is absorbed in our gastrointestinal system. Distribution, medication is transported through the circulatory system to point of action. Maybe the liver is the point of action. And then go for metabolism. Medication is then metabolized by the enzyme inside liver or hepatocyte. Finally, it is ready to excrete. Drug travel through the kidney where it is removed from the body. Now, let me talk about the drug absorption. So, drug absorption is the process by which a substance moves into bloodstream from site where it was administered. Absorption may be type of absorption, passive, active, or pinocyte. So this is the membrane and this is the cell. Maybe blood directly cross over. Passive transport, active transport, drugs interact with the receptor and cross over the membrane, get in, or sometimes go through the pinocytosis. So drug molecule attached to the cell membrane make a globules, then these globules move on, come to the exit site, lysis of the wall, and release the drugs. So drug absorption is a pharmaceuticals parameter that refer to the way of drugs is absorbed from a pharmaceutical formulation into the bloodstream. Several factors can affect the absorption of drugs into the body. And this factor basically include the route of administration of drugs, which route you get, needs orally, buccal, sublingually, rectal, parental, or inhaled. Oral disintegration or buccal tablet or oral solution, right, is orally, or liquid, syrup form, suspension, powder, capsule, tablet, coated tablet, enteric coated tablet. So this is all are the forms of drugs we intake in the body. So this is the oral form, but if you take the drugs in IV route, this should be faster than the oral route. Other one is doses forms, the route and forms. Route might be enteral or parental or just superficial topical. The main difference between enteral and parental feeding is the enteral feeding is delivered the medication, drugs, or food through the human gastrointestinal tract. In contrast, parental, the feeding is the delivery of medication, drugs, or food into the bloodstream by bypass the gut. So enteral may be tablet, capsule, oral soluble medication, time release capsule, suspension, syrup, emulsion, solution, suppository as well, sublingual or buccal tablet. Parental injectable form, solution, suspension, emulsion, and topical means aerosols, ointment, cream, paste, powder, solution, gel, transdermal patch, all are surface we use in our surface of the body. So absorption continue. Rate of absorption depends on the route of administration. Drugs can be administered in one or two ways, either enterally or parentally. As I told you, enteral, which means the drugs is given directly into gastrointestinal system through mouth, through the rectal, or through the tube entering the system. Parentally, by all other route that do not touch our gastrointestinal system. So as I told you, if you compare and contrast parental with enteral, parental feeding is the delivery of drugs or delivery of food into the bloodstream by passing the gut. How quickly a medication is absorbed depends on how it is administered and whether it is topical or systemic. So it makes sense if you deliver the medication systemically, okay, it should be quickly absorbed rather than if you use the medication in surface of the body. So topical drugs act locally. Systemic drugs act on one or more body systems. Here are two examples, like Desitin or Belmax to treat the diaper rash. Another example of Embla cream, which is applied as a local anesthetics prior to blood draw or IV injection in a small children. So this is the route we use. What else? There's few more information about the absorption. Systemic medication are taken by mouth or administered intravenously, intramuscular, or as a patch. So in this picture, this is the skin and this is the patch. So we give the medication by mouth or orally, IV route, intravenously or intramuscular. Liquid medication act faster than pills because pills must first be broken down to the absorbed. Intramuscular injection provide fairly quick absorption because muscle have a high blood supply to provide rapid entry into the circulation. What else? The intravenous. Intravenous injection is the faster way to blood supply because the drugs is injected directly into the vein. So you deliver the medication inside the blood, and blood is the circulation. They bring it to the site of action. And also, care should be taken when giving IV medication so that They are not absorbed too rapidly. For example, if morphine is given too rapidly, patient may become severely hypotensive and respiratory system depressed and stop the breathing. It is life-threatening condition. So as a healthcare provider, it is very important to follow the rules. So if morphine, we should give very slowly because saving life is the priorities. Absorption of medication here, it is called bioavailabilities, is a subcategory of absorption, the percentage of the administered drug dose that reach the systemic circulation. So bioavailabilities is the fraction of administered drugs that reach the systemic circulation. Let me recap it, my friend. Bioavailability is expressed as the fraction of administered drugs that gain the access to the systemic circulation in a chemically unchanged form. So what else? Bioavailability occurs after absorption and hepatic drugs metabolism. Oral route is always less than 100%. Intravenous route usually 100%. Other factor that may vary the absorption rate and bioavailabilities of medication. What are the other factors? Other factor, fat or lipid solubilities and pH level. The more soluble a medication is in fat or lipid, the more easily it is dissolved and absorbed through the stomach into the bloodstream. So what are the rules of pH? So medication with low pH means acidic media, are easily absorbed in the stomach, whereas those with a high pH means alkaline, basic, are less likely to be absorbed effectively. And what are the other factors? Concentration of medication, length of contact, aging, food, and also depth of breathing. Let me explain a little bit. NCLEX board asks the question from here. So the higher the medication concentration is, the more easily the medication is absorbed. What else the age? Like your patient is extreme ages, like too young, infant, or too old, elderly. Both children's and older patients absorb more medication through the skin than do healthy adults. So if you give them ointment, cream, pads, so topical medication is usually applied in a very thin layer. Food. What are the rules of food in absorption of drugs. A large amount of food slow the absorption of systemic medication. Stomach acid facilitate absorption of systemic medication. Therefore, medication is absorbed faster when acid in the stomach is increased. Depth of breathing for inhaled form, like salbutamol for bronchial asthma. Inhaled, the more deeply patient breathe or more medication they inhale. For example, ask the patient to inhale deeply to receive maximum benefit during the treatment of bronchial asthma. Now, let me talk about the first pass effect, or we call it as the first pass metabolism. So what it is? So first pass effect or first pass metabolism, same word. So here a drugs I take through my mouth, then drugs go to esophagus, enter to the stomach. Usually, like you eat some protein and carbohydrate, after digestion, the food go to the small intestine and then go last gut. But about the medication, when we take the medication go through esophagus and the stomach, then stomach. From the stomach, medication go through portal circulation, enter to the liver, because liver is the destination for chemical reaction we call metabolism. Through the portal circulation, medication or drugs come to the liver and then go to systemic circulation. And this system is called hepatic portal system. What is first pass effect? The bioavailability of the drugs to less than 100% is reduced. But if you ask me, what is the first pass metabolism? Let me explain. The first pass effect is the term we used for hepatic metabolism, means liver metabolism. Metabolism of pharmacological agents means drugs when it is absorbed from the gut, means stomach, and delivered to the liver via portal circulation. The greater the first pass effect, the less the agents will reach the systemic circulation when the agent is administered orally. Let me go explain here. So drugs route and first pass effect. Here, hepatic arteries, oral, portal, venous, and rectal. This is the first pass route. What is the non-first pass route? Like if you give medication inside the ear or inside the mouth, buccal, inhaled, intra-arterial, intramuscular, intranasal, intraocular, intravaginal, intravenous, subcutaneous, sublingual, or transdermal. So we can avoid the first pass route. So it is called non-first pass route. So now let me talk about the drugs distribution. Distribution is the delivery of drugs to the appropriate site after the drugs has been absorbed into the bloodstream. Once the medication is in the bloodstream, it is rapidly distributed throughout the body. It influenced by blood flow or affinities to the tissue or protein binding effect. So distribution depends on protein binding. So drugs bind with the protein, then transmit. Distribution depends on blood flow. If blood flow is more, distribution will be rapid. Distribution depends on body tissue affinity, right? And finally, all of this factor lead to pharmacological effect of drugs. The amount of drugs that actually reach the receptor site determine the extent of pharmacological activities, or drugs are distributed in the plasma and are bound to variety degrees with protein, particularly albumin. So when we eat or take the drugs, go to the stomach or liver through the hepatic system, then circulation. In the circulation, they bind with albumin. Protein of drugs bind is in active form, not available to the receptors. Portion of drugs unbound, it is called free drugs, and they are active. Only free drugs can cause a pharmacological response. Note for NCLEX. Liver or kidney disease cause the low serum albumin level, so less protein binding site and excess free drugs and drug toxicity increase. Here a picture was showing this is albumin, means protein, and this is the drugs. This is the drugs. So drugs bind with protein. In here, drugs bind albumin. It's called bounding drugs. When the drugs is not binding, unbound drugs, this is very active and start pharmacological action. Now, more information about the distribution. So certain tissue have specialized physiological barrier, such as densely packed cell that allow nutrient or certain chemicals, but not other substance. Include medication to pass from blood through the tissue. Like this is the tissue, most capillary in the body, but this is the capillary inside our brain. This capillary has surrounded by special type of tissue. This tissue not allowing any substance from the blood to get in. Only selective substances are allowed to get inside the brain. And this outer layer is called blood-brain barrier. This type of same thing, the placenta, the infant is surrounded by a layer, is called blood placenta barrier. So most of the drugs are not allowed to go in. In same as testes, protected by a layer and is called blood testicular barrier. All of three together we call anatomical barrier. Blood placental barrier helps to filter the drugs and other substance passing from mother to the fetus and thereby protect the fetus. However, alcohol, cocaine, and even some over-the-counter drugs can cross this barrier easily and cause the harm. Most lipid-soluble drugs rapidly cross this barrier, but water-soluble drugs do not. Many drugs, such as psychotropic drugs, can cross the blood-brain barrier. And third one is blood testicular barrier, protect the male reproductive organ from toxic that cause damage the sperm. Many psychotropic drugs have negative sexual effect, such as decrease the libido, because they cross both blood-brain barrier and blood testicular barrier. Metabolism. So, what is metabolism? So, metabolism is a process or biotransformation, means that the medication is chemically transformed to a less active or inactive form. We call it metabolism. So metabolism is a process where a big molecule is broken down to smaller molecules, maybe active or inactive. The drugs is metabolized by the liver or kidney and intestine. So drug metabolism can categorized. We call phase 1 and phase 2. Phase 1 reaction including oxidation, reduction, and hydrolysis. And phase 2 reaction include drug conjugation. This biotransformation may actually determine the route of administration, because metabolism may transform the medication into a useless form too quickly. For example, insulin given by mouth is virtually useless. Stomach acid breaks down the insulin to an inactive form because it can be absorbed into the bloodstream. But when you take the insulin subcutaneously, they are active. But if you take insulin by mouth, it is inactive. When drug is administered in its inactive form to become activated through metabolism, we call prodrugs, like levodopa to dopamine active, diazepam to oxazepam active form. Also, the drug metabolism can be affected by some factors like patient age, genetics, disease status, and other factors. What else? How age influence the metabolism? Blood flow to the liver is decreased in elderly, and therefore metabolism will be slow. Genetics, which determine how much of certain enzyme that we each have, also determine how fast we metabolized a medication. Definitely, the metabolism of African American, metabolism of Asian people, or metabolism of Caucasian is not same, because our genetics materials is different. Some diseases that affect the liver may cause slow the metabolism. In all other these situations, medication may build up in the body to toxic level as the patient may continue to receive more and more doses of the medication, with it not being broken down into harmless metabolites. There are some examples of condition and drugs that affect our metabolism. So first of all, category example, like disease, cardiovascular dysfunction, renal insufficiency, decreased drugs metabolism. Some condition like starvation, obstructive jaundice, genetic constitution, decrease metabolism. Like some drugs, barbiturate, nifedipine, phenytoin, antifungal, ketoconazole, basically increase the drug's metabolism. How they increase? Because the P450 inducer has play roles. Let me talk about drug excretion.